a 44-year-old patient died in the dental chair in a dental implant clinic not 15 minutes from us in Ponte Vedra, Florida. You may have seen this article go online. It's going pretty viral. I want to address it because I want to, I know a lot of you are scared, and I want to make sure that you understand, at least from a dentist perspective, what about that article is true and what about that article is maybe some opinion. And so that way you can make a comfortable decision about your dental implant needs. So the first thing I want to approach in that article is that 23 teeth were taken out and implants were put in. That is not why this patient passed away. It's a super sad situation, but that's just not what happened. People have been extracting teeth for hundreds of years and having dentures for over 100 years. It's a routine procedure. And I've seen a lot of comments and people say, I can't believe you're putting in implants, the day of extractions. Well, again, that is super common, very routine, and actually better than not doing that. Think of it like a hip implant. You wouldn't go into the hospital, go in for a hip implant, and they go, actually, we're just gonna go without the hip for a few months and then come back and actually put your implant in. That just does not happen. In a dental implant and a hip implant, while different sizes, are the same exact concept. So it is not wild, it is not weird, and that is not the issue at hand here. Even though the article seemed to highlight that and was obviously trying to be sensationalized, that's just not what went on. More than likely, it was something to do with sedation. I know particularly at our clinic, and a lot of clinics across the nation, they bring in a secondary anesthesia provider, right? I'm cleared to do sedation myself. I don't feel it prudent, at least in our clinic, to do that because I want to be able to focus on what I'm doing, which is the extractions and/or dental implants, and have someone else providing the sedation. Much like I've kind of mentioned before, having a pilot and a co-pilot, right? I can fly the plane, right? But a co-pilot is there to add an extra layer of security. What if the pilot deviates when they shouldn't be? What if they're having an issue and they can't handle it? Having two people there that are, able to do it is going to be better. Right? We actually bring in an anesthesiologist, not even just a CRNA, although they would be great too. So that adds that extra layer of security. So again, that's something maybe you should ask your provider if you're going to be getting this done, not just here in Jacksonville, but if you're your provider, you would want to do that and say, hey, all right, I'm being sedated, because they don't get paid to put you to sleep. They get paid to wake you up. Much like a pilot, they don't get paid to take off the plane. Anybody can hit the throttle and lean back, but they get paid to land the plane. So I saw this article. I just wanted to approach it. Again, it's very, very sad. I don't want to deviate from the fact that a person has lost their life that absolutely shouldn't have, but I don't want people to take the wrong message from this and that it's scary, because it shouldn't be. It is a very straightforward procedure. It is very routine. It is safe, and it can be done very, very well day in and day out.